Hi everyone, good evening. This is Dr. Sumner. I'm coming here to you live for our Facebook series, Dr. Sumner's Summit to Wellness. Thanks for joining. My apologies for the slight delay. We had a little trouble getting the kids to bed, but we're back on track, so glad to have you here, whether you're here live or catching the replay later. So good to have you guys here. For those of you who do not know me, my name is Dr. Sumner. I am your board certified family medicine physician. I am dedicated to empowering you to become well and then to educate your communities to do the same. So I'm glad to be here tonight. Our talk for tonight is about HIV and AIDS. As you may be aware, December 1st is actually the World AIDS Day. So I thought there's no better time for us to maybe talk about some things related to that topic and dispel some of the myths out there, because there's a lot of stigma, there's some discrimination that a lot of people who might have HIV and AIDS have to deal with on a regular basis. So I'd love for us to just all get a little bit more educated about what is HIV and a number of things surrounding that. So let's get started. If you're joining me, definitely tag your friends, family, anyone who you think would benefit from this information, which I really think is everyone. Comment while you have a moment, and that will definitely help to push this video up so more people can gain this, I think is going to be helpful information. So good to join you guys here. So what we're talking about again is HIV and AIDS, and there's a big stigma surrounding HIV. A big thing is that 1 in 8 people who are living with HIV, they're actually denied access to their health care. So that's pretty sad to think about. And then there are some people who are living with HIV and they are shunned by their family, their friends. They're affected if their employers find out or their schools find out. So there's a huge stigma surrounding AIDS. Does anybody have any ideas as to why that could be? Why is it that there's this huge stigma that surrounds people who are diagnosed with HIV and AIDS? Why is this such a difficult topic for us to speak about? I've done some research. Definitely comment if you have any ideas, because I'd love to hear from you. Me and my doctor colleagues would love to hear why it's so hard for this to be a regular topic. But a big thing is that since that HIV epidemic that occurred in the 1980s, there's a lot of bad news out there that's not even accurate, that still persists today. And there was a lot of difficulty. A lot of people with HIV, they didn't know how it was transmitted, and so they thought that they were dealing with a lot of contagious situations when that really isn't the case. And we've learned a lot about it since then, which is good news. And aside from that, there's a lot of people that think a lot of things that are not accurate. Number one, that HIV and AIDS are associated with death always, and that is definitely not the case since a lot of treatment is now out there. Another thing that people falsely believe is that HIV is only associated with behaviors that some people disapprove of, like homosexuality, drug use, sex work, or cheating. And there are a number of HIV and AIDS cases that are not associated with any of those things. There's a lot of people that falsely believe that HIV is only transmitted through sex, which is taboo to talk about in a lot of cultures. So that's another reason I gather that people don't talk about HIV and AIDS. Again, if you have any ideas as to why this is such a taboo topic, please comment and let me know what you're thinking. Also, a lot of people falsely believe that HIV, it's the result of some kind of personal irresponsibility or a moral fault, and like infidelity, for example, and they think that that person should be punished, and that's clearly not the correct way to think. That's not really the case either. So there's a lot of inaccurate information about like how HIV is transmitted and a lot of irrational behavior that's associated with it. So that's the point of our talk today, is to really get to some of the nitty-gritty, and hopefully you guys can leave this talk with feeling a lot more empowered and a lot more in the know about what really is HIV, how can you get it, and what happens if you do. So I'm here today to basically help educate anyone who is willing to listen and kind of kill some of the stigma that's associated with this disease, and honestly a lot of unnecessary discrimination associated with this disease. I'm here to dispel these myths, and let's get to the bottom of it. So this is going to be an interactive talk. Definitely comment, ask questions if you have along the way. If you feel more comfortable messaging me questions later, then I understand. Please feel free to do so. So let's first see, is HIV even worth talking about? The good news is that in like 2004, there were 1.4 million cases of HIV in the U.S., 1.4 million. And that's gone down, so that's good news, down to about 1.1 million. So that's still a lot of people that are dealing with this disease. And it's estimated that about 25% of people in the world who have HIV, they are undiagnosed, meaning they don't even know that they have it. In the U.S., that gets a little better, but it's still kind of scary. 1 in 7 people living with HIV, 1 in 7 in the U.S., they are unaware that they have this diagnosis. So that's about close to 15%. So there's a lot. I would say that's a good amount of people, hundreds of thousands of people, matter of fact, who have HIV and they are unaware of it. So in the United States, about 38,500, about 39,000 people are infected with HIV new every single year. And since HIV, the epidemic in the 1980s had started, about 70 million people have been infected and about 30 million people have died from HIV and AIDS. So we've got a long way to go, and my hope is that with doctors such as myself and many of my other colleagues who are working to better educate our patients, our families, friends, communities, that hopefully that will help with lowering these numbers over time. So basically for tonight, we're going to talk about what is HIV, where did it come from, how do you get tested, what is the treatment, and we're going to talk about some myths along the way. So what is HIV? HIV, give me a comment below if you know the answer. Sorry about that. HIV stands for Human Immunodeficiency Virus. Human Immunodeficiency Virus. And basically what that is it's a virus, like we catch the cold virus or the flu virus or something of that nature. But this is a much more powerful virus, of course, than what I just named. Different than some of the other viruses we get. When you get HIV, your body will not get rid of it. You will have HIV until you die. You have it for life. But basically HIV, the way that this virus works is it attacks your immune system. So it lowers a certain type of cell in your body, an immune cell called CD4, C as in cow, D as in dog, 4. It lowers those cells that are usually used for your immune system. Like, if you get a cold, if you get pneumonia, if you get cancer, it's usually because your immune system is not acting the way that it should. So that's what AIDS does. It kills your immune system cells, your CD4 cells, and when it gets to a point that it has killed so many, that's when we call it AIDS, and we'll talk about a little more what that means. So HIV, that virus, it can kill these cells and get to the point that your body can't fight off infections or even certain diseases like cancers. And that's when usually, unfortunately, AIDS really does affect someone to the point of even death, is because one of those infections has taken advantage of their body. So the question though is, where did HIV even come from? A lot of people wonder about that. How did it seemed like it came out of nowhere in the 1980s. Well, apparently there were cases even way back in the 1800s, but we found, though, that scientists they've identified a chimpanzee that's in Central Africa to be the source of HIV infection originally, and that chimpanzee had a certain type of virus called the simian immunodeficiency virus that was transmitted to humans over time, and then it mutated to become HIV, human immunodeficiency virus, and eventually, it migrated that virus from parts of Africa to all over the world through different means that we'll talk about. So that's how it came to pass. With regards to stages of HIV, there are different stages, especially when people don't get treatment for HIV. It can proceed to become different things. So here's a little graphic for you. There's 3 stages of HIV. One is acute infection, and that's basically, that can be about 2 to 4 weeks after infection with HIV, and these people, they'll usually have like a flu-like illness. It'll feel like you'll have fever, sometimes swollen lymph nodes, you'll just feel really tired, and you'll think that you have a really bad cold or the flu. And then you'll get to this clinical latency phase, which you'll feel totally normal. You'll feel like you felt before you were ever infected, and that can actually last for 10 plus years. It can last for decades, depending on whether or not you're treated, what other environmental stressors you're dealing with. And then, especially if you are not treated when diagnosed with HIV, it can progress to this 3rd stage, which is AIDS. And that is when your viral count gets really high, your HIV count gets really high, and those CD4, those immune cells, get really low. We actually technically have a number for it. If your CD4, those immune system cells, are less than 200, that's when we say that you officially have progressed to the AIDS stage. So that's the difference. There's HIV acute infection, then there's this latency phase where you're totally feeling fine, like nothing's going on, but you do have HIV in your system, and then, especially if you're not treated, if the virus continues to attack your immune system, it can get to the point of AIDS. So without treatment, people with AIDS usually survive around 3 years. And common symptoms of AIDS could be similar to when you first get the HIV virus. It could be fever, sweats, swollen lymph nodes, weakness, weight loss. And then when it does progress to AIDS, you will more so see issues with getting infections that you probably have never gotten before, such as, like I said, pneumonia, things of that nature. So the big question for a lot of people is, how do you get HIV? And that is also something that surrounds the stigma associated with HIV. A big thing with regards to that is that there are only certain body fluids that will allow you to pass on HIV. A lot of people think it's anything. Unfortunately, some people even think it's skin-to-skin contact, but that's not the case. The only body fluids that you can pass the HIV virus are through blood, semen, which some people call cum, pre-seminal fluid, which some people will call pre-cum, rectal fluids, vaginal fluids, and breast milk. That's it. You cannot pass on the HIV virus through any other means. Some people think that kissing, you can pass HIV through kissing. That is an extremely rare situation. In that case, the HIV virus was not passed on through saliva, through your spit. It's actually passed on through blood. Like if someone has an open sore in their mouth, and then blood gets through them kissing, and then that person has an open sore in their mouth, then that's the only way that HIV virus could be passed through kissing, and those are super rare situations, FYI. So these fluids, blood, semen, pre-semen, vaginal or rectal fluids, or breast milk, they have to get in touch with a mucous membrane that's damaged, such as, again, your mouth that's damaged, or other areas like your vaginal area, rectal area, etc. That has to have some kind of opening for one of those fluids to enter through in order for transmission to occur. So that takes a lot of things to all poorly line up in order for someone to actually get HIV. But clearly it does happen because the cases are quite tremendous even in the U.S. Again, 1.1 million people in the U.S. right now are suffering from HIV. So you can get HIV through a number of ways, and I've got a little image here that might help to sink it in a little bit. You can get HIV through sex without a condom, or a condom that which integrity is poor, like it's ripped or torn or something like that. You can get HIV passed from mother to baby. You can get HIV sharing injection equipment, or you can get HIV through contaminated blood, like through a transfusion or organ transplant, which again is rather rare because we go through a lot of work as healthcare professionals to screen all of those things and sterilize, etc., before anyone gets a transfusion or organ transplant, God forbid, attached to the HIV virus. But you can get it through vaginal sex, which some people do not think that's the case, but you can. And you can certainly get it through sharing needles or syringes that are infected with the HIV virus. You're very welcome, Miss Natalie. Thanks for tuning in. HIV, believe it or not, can actually live in a used needle for up to 42 days. So HIV, it can't live in dried blood for that long. It can actually live in dried blood for about 5 to 6 days, believe it or not. So like if it's blood that's sitting on a surface and again, a mucous membrane that is torn or something like that gets in touch with it, then you can technically get HIV, but it can live in a used needle for up to 42 days. As for a mother during pregnancy, you can pass on HIV through breast milk, and also then on treatments to help it on to your baby through pregnancy, like if you were to, have your baby delivered vaginally. Being stuck with a HIV needle, of course that can happen. But saw that image, you don't have any volume. Oh no. Please give a thumbs up if you can hear me any better with this. I don't know why there's no volume, but thanks for letting me know, Miss Teresa. Let me know if you still can't hear me. You can't hear me still. Can anyone else hear me? Can you let me know if you can hear me? Or is it just a problem for Miss Teresa? Thank you. You cannot get HIV through any of these things. You cannot get HIV through, you can hear me, great, through kissing, sitting on a toilet seat. You cannot get HIV from hugging. You cannot get HIV through bathing. You can't get it through sharing food. This is from avert.org. They're a very helpful campaign to help educate people about HIV. Sharing food, let me just clear that up. You can technically get it through sharing food. That's if, again, someone with HIV were chewing up food for you and they had an open sore in their mouth, and then they chewed up a lot of the food to have a certain amount of blood on the food, and then you had to eat that food. So like it's basically close to impossible. And then if you cannot get HIV from someone sneezing on you or coughing on you because it's not passed through respiratory droplets, it's not passed that way. Again, it's only passed through those fluids that we mentioned. You cannot get it through an insect bite. Some people think you can get it if like a mosquito bites someone who has HIV and then they bite you. That's not true. Mosquitoes suck blood in, but they're not going to give you HIV infected blood. That's not the way it works, and you cannot get HIV through sweat. So in extremely rare cases, HIV has been transmitted through oral sex. Some people think that that does not happen, but if a condom breaks, and again, that person has a sore in their mouth, then you can get it that way. as well. Again, if you have questions along the way, feel free to ask me. But I hope that helps dispel some of the concerns about how you can get it and how you can't. So again, usually it's only through, or it is only through blood, semen or cum, pre-cum, breast milk, vaginal fluids or rectal fluids. That's it. And those have to come in contact with a way to get into someone's blood, which is usually directly into their blood or through a mucous membrane such as your mouth or your vaginal area, rectal area, that is open for you to receive it. So if you have broken skin, most of the time that will not transmit HIV unless that other individual, again, has a mucous membrane where their integrity is off. So hopefully that helps. Was that helpful? Give me a thumbs up, comment, let me know if that was helpful information so far. Now, my phone battery is going to die soon, and so I'm going to try to switch over to the computer if I need to, but hopefully we don't have to do that. So another question, how long does HIV survive outside of the body? So HIV, as I said, it doesn't really survive long. Usually it only survives for a few minutes if it's, out onto some other random surface such as a table or your bed sheets or something like that. But again, in dried blood, it can survive 5 to 6 days. It can survive in a needle for about 40 days, but usually it doesn't survive very long. So saliva, tears, or sweat that's not mixed with the blood of an HIV positive person, you can't get HIV that way. So there's a lot of ways you can't get HIV that unfortunately we think you can. So why isn't everyone getting tested? That's a big question that I actually have as a doctor and some of my colleagues. I'm concerned because it is clearly a very horrible disease, meaning it can kill people in very sad ways. And so I wonder if we have screening tests for it, why aren't people getting tested? Do you guys have any ideas? Like, why is it that people are not getting tested for HIV? The only reasons I know of or can think of right now is that people are fearful. They are concerned because there is technically no cure for HIV. They're concerned for stigma, discrimination, like we talked about. Do you guys have any other ideas why people aren't getting tested? Because I'd love to hear it. But that's what I have heard and figured out so far. But why do we need to get tested? That's the big question. We need to get tested because testing is the only way to know for sure if you have HIV. You cannot figure it out by yourself. You can't. You just can't. So, I mean, I know that that's tough. There are people who have dealt with, having contact with an HIV positive individual, and they're concerned and they feel like, oh my God, I feel really run down. I know I have it. I just know I have it. But they won't get tested. And that's concerning because getting tested is the only way to know for sure if you have it. And if you have it, then you can get treated. But if you have it and you're not tested, then you can't. So I would highly suggest getting tested. And knowing your status can help keep yourself healthy, and it can keep your sexual partner healthy. It can keep your future children healthy. So getting tested is, I believe, of the utmost importance. And the World AIDS Day coming up on December 1st, the big motto for that day is know your status. So get tested. There's a lot of people who are very nervous about it, but the reasons to test, they far outweigh the risks of not getting tested. So there's actually a recommendation out there, all family doctors should be aware of it, that anyone between the ages of 15 and 65 years old, you should be tested at least once in your life. If you're younger than 15 years old, but you are at high risk for HIV, or you're older than 65 and you're at high risk, then you should be tested as well. But at least if you're between 15 and 65, you should be tested at least once for HIV. And it's really easy. It's actually, you can have it tested with a pinprick. Just like, you know how they test your sugar for diabetes, you can test it through a blood draw, or you could even test it through a swab of your saliva. So there's a lot of quick and easy ways to get tested, and again, it's the only way to know for sure if you have HIV or if you do not. So definitely, if you have not been tested for HIV and you're between those ages especially, then please talk to your doctor about it. And if you're at risk of getting HIV, then you should be tested more often, more like once a year or more often than that. So please talk with your doctor if you've yet to be tested. It's important to know your status. So as I said, that HIV test is performed a bunch of different ways. There's three most common ways to test for it. There's the NAT test, and that one I'm not going to talk about much. It's the most expensive test. It's the test that will detect HIV within about 10 days of exposure, so it's really helpful to detect it early, but again, unfortunately, it's not always covered by insurance. Then there's what's called the antigen antibody test, and that's what most people, most doctors, healthcare providers will use to test. And you can test for that in your blood, you can test for it in your saliva, but that's a very helpful test. And again, you can also test for it with a pinprick, and they are basically testing for protein in your blood that helps to fight off HIV, and if that number is above a certain number or it hits at all, then the concern is that you could have HIV. So if you test positive with the pinprick test or the saliva test, then actually you will need a follow-up test to confirm that you actually have HIV. But either way, blood test, a draw in your veins, a pinprick, saliva, they are actually 99.5% accurate. Those tests are 99.5% accurate for HIV. So there's almost no error with regards to that in detecting HIV. So please, again, I would highly recommend getting tested, especially if you're between that 15 to 65-year-old age group. The only issue, of course, with testing for HIV is because of the way that virus works, if you're tested for HIV, it may not show up in the test immediately. It could actually take up to 45 to 60 days after you're exposed to HIV for your test to come back positive. So if you've been exposed or you're concerned you've been exposed and you've been tested, and you've been told you're negative, that's great news, but it doesn't mean you're through the woods yet. You should be tested again in another 1 to 2 months to ensure that you truly do not have HIV. So that's really important. Make sure to keep that in mind if you're ever in those shoes. There is no test that can detect HIV immediately after infection, okay? There's no test. So the question is where to get tested. If you're concerned you don't have insurance or your insurance may not pay for it, that's just not the case. You can get free testing at a lot of sites. You just need to go to the CDC's website. I think it's gettested.cdc.gov, and you can find sites where you can get tested for HIV, typically even for free, even if you don't have insurance. So please, again, know your status. And I'll throw that link in the comment section as well. A question that I get often too from my patients is, if I get tested, who's gonna know? Like, I don't want to get tested and then, you know, my sister finds out, or my neighbor finds out, or stuff like that. So actually the case is that if you are tested, if you take an anonymous test, absolutely no one will know the results. And even if you take a test like at the doctor's office or the nearby clinic, etc., it's a confidential test, and still the only people that know your results would be anyone who has access to your medical record, which should really only be you and your doctor. And then in most cases, state and federal law might require your doctor to report your HIV status to the health department, but The health department will not hold any identifying information. Let me repeat that. The health department will not hold any identifying information. They won't keep your name. They won't keep your address. The only thing that they will have really is, you know, there's a person in Pittsburgh, PA, who has HIV. They're 42 years old and female. And that's what they'll report to the CDC. Nothing beyond that. So the only people that will know your HIV status should be the person that tested you, i.e. your doctor, you, and anyone you decide to tell. Now, when it comes to who do you tell, that's a personal decision. I would highly recommend that you do tell your sexual partner, because you are putting them at risk of getting HIV as well, and they are at much higher risk if they are unaware of your status and, you know, display behaviors that would put them at higher risk. So it is, I believe, important to share that with your partners, but it truly is your decision. If you would like the health department to let your partner know, or previous partners know, then that is their duty. They will do that, and they will do it anonymously. They won't tell your previous partners that, you know, so-and-so has transmitted this virus to you. They will just let you know you've been in contact with someone who has had HIV. We highly recommend that you get tested. And that's how the health department will share that information. If a question I get often too is, if I have a negative test, does that mean my partner is HIV negative also? What do you think? Comment. Let me know what you think. If you have a negative HIV test, does that mean that your partner is also HIV negative? So the answer is no. No, it doesn't, because HIV, it's not necessarily transmitted every time you have sex. So you could have had sexual encounters with your partner for a number of times and you don't necessarily get HIV. Yes, you're correct. No, 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 that's not the case. And another question that I do get along those same lines too is that if you have HIV already, then does that mean that you can't get HIV again? That's another question I get. And believe it or not, the answer to that is no as well. Sorry, if you have HIV already, can you get HIV again? And the answer is yes. The answer to that is yes, because there are actually different strains of HIV. So if you have HIV already and you have an encounter with someone else who infects you with HIV, it's called HIV super infection. So you can get HIV twice or more possibly, because there are different strains of HIV. And all that will do is, of course, cause more damage to your body, lower your immune system even more. So can you take a medicine to prevent getting HIV? Is there an HIV vaccine? Is there an HIV vaccine? What do you guys think? Is there an HIV vaccine? Okay, so the answer to that is no. We do wish, I'm sure that there are a number of research programs out there that are working on it, but as of right now, there is no HIV vaccine. However, there is a medication out there that will help you prevent getting HIV after potential exposure. So if you have encountered a situation where you think you may have been in contact with an HIV positive individual, and then also through one of those means we discussed did possibly get HIV, then you can take a medication. It's called pre-exposure prophylaxis, also known as, post-exposure prophylaxis, also known as PEP, P-E-P, that you can take within 72 hours of HIV exposure. And it lowers your risk of you actually getting HIV by 70% if you take it correctly. So there is a medication out there that if you're concerned you've been exposed to HIV and that you may have transmitted or received it, then you can take this PEP, post-exposure prophylaxis. call your doctor and talk with your healthcare provider about it. So, but there is no vaccine for HIV. Thank you, Pam. I do hope this information is helpful for you guys so far. What does a positive result mean? So if you do test positive, as we talked about, then if you test positive through saliva or through the pinprick test, then you do need a follow-up test to confirm it through a blood draw. And if you did have a positive test through a blood draw, then it means that you do have HIV. But that does not mean that your life is over. As we talked about, there are 3 different stages. There's that early stage, there's the HIV stage, there's the latency stage that can last for decades, especially if you're treated, before it even becomes full-blown AIDS. So the big thing is that if you're diagnosed or you know someone who's been diagnosed, the big thing is to get treatment as early as possible. And the treatment, we call that antiretroviral therapy, also known as ART, antiretroviral therapy, ART. And it is not the easiest medication to take, but it certainly is much easier than dealing with HIV when it becomes AIDS. So I would highly suggest that if you've been diagnosed or you know someone who's been diagnosed, encourage them to start this treatment as soon as possible. The way that treatment works is it helps to keep that load of HIV, the viral count, low, and so you can keep your immune cells, the CD4 count, nice and high and not be prone to getting any of these deadly infections. I know that receiving a diagnosis of HIV, that it can be life-altering. It can make you feel a lot of different emotions, sadness, anger, even unfortunately sometimes hopelessness. But there are a lot of resources out there to help anyone who's been diagnosed. Aside from talking with your healthcare provider, I know that as a family doctor, I hope to be there for my patients anytime that they deal with any life-altering diagnosis. We also have social workers. There are HIV counselors. My husband actually is a certified HIV counselor, so message me if you need to be in touch with him. But there are a lot of resources out there for people to be able to deal with this diagnosis and move past those feelings of hopelessness, anger, fear, upset, all of those feelings, to get past it, because I've seen, honestly, in my experience, that AIDS, it only defeats people when they get to the point of staying in that place of being hopeless and isolating themselves from the rest of the world due to unfortunate stigma and discrimination. And we pretty much always beat it when we are able to change our mentality. Your community is supportive of you, and that you can feel that feeling of hope again. So being HIV positive, it does not mean that you have AIDS. AIDS is the most advanced stage of the disease. So HIV, though, it can lead to AIDS if you don't get that treatment. And a question I get, especially for patients who are not insured, is who is going to pay for this treatment? Because yes, it can be expensive. The good news is that if you have insurance, usually your insurance will cover it. But if you have a high copay or high deductible, or you're uninsured, you can't afford treatment, then there are a lot of resources out there to help you afford treatment. So again, reach out to your doctor, social worker, HIV counselor, someone who can help you find the resources you need so you can get the treatment you need right away. Because the earlier you get treatment, the less likely you are for you to really suffer from this disease. There is something else aside from the PEP that I mentioned to you, post-exposure prophylaxis, which again is a medication that you can take if you've been exposed, you think, to HIV, and it will reduce your chances of getting HIV by 70% if you take it within 72 hours, 3 days of being exposed. But there is also a medication called pre-exposure prophylaxis. We call this PrEP, pre-exposure prophylaxis. And this is a medication for people who are at high risk of getting HIV. For example, if you are having sex with a partner who is HIV positive, that's a very common one, then you can actually take PrEP, and that will decrease your chances of getting HIV by 90%. 90%. if you were taking it correctly, like every day or twice a day, however it would be prescribed for you, you would have to take it for the entire time you were at that risk. So if this partner is your lifetime partner, you would have to take it every day for the rest of your life. But again, it decreases your risk of getting HIV by 90%. So if your provider, your healthcare provider, your doctor hasn't brought this up to you, or this is the first time you're hearing about it and it's something that you would benefit from or someone you know would benefit from, then ask them please about PrEP, pre-exposure prophylaxis. It's pretty darn helpful. Typically the statistics more around 70% to 90%, but that's incredibly higher than no percent. So the name of it by brand right now is called Truvada. It's a blue pill. So definitely chat with your doctor about it if it may be helpful for you. And like most medications, Truvada, it's not benign, but it's nothing close to having AIDS. But there is the potential of side effects such as nausea or possible kidney damage, but your doctor will be paying close attention to your kidney numbers through blood work, etc. So I don't believe it would be anything you have to worry about. So those are the big myths, the questions that I had when I decided to bring up this topic. I hope that some of that information was helpful for you. If you have any other questions, then please feel free to type them in the comment section. But I do hope that this was helpful information. As a family medicine physician, I believe that I'm in the best position to help educate our communities about what really could be this very deadly disease, and in a lot of ways could be either prevented from getting it in the first place, but definitely prevented from turning into AIDS. So I'm doing my very best to keep our population educated and to battle this stigma and getting the appropriate treatment for the people who need it. So if you're between the ages of 15 and 65 and you have yet to be tested for HIV through a blood draw, a pinprick, saliva test, then please talk to your doctor about this ASAP. And if you're at high risk of getting HIV, then it shouldn't only be once. It should probably be at least once a year. So please, if you need to have a conversation with your doctor, please do that ASAP and talk with them about any concerns that you have. So was this information helpful, guys? Comment below, give me a thumbs up, share this with your friends and family, please. I do believe that at least one of the things that I've said tonight might have been new information for you. So if it was new for you, it will probably be new for someone else, and it may just save a life. So please share this information, and I do hope that this was helpful. I know we've covered a lot, but I don't want any questions to go by. So if you have any questions, let me know, or message me if you have questions later on. But it was really a pleasure spending time with you guys as usual. I am excited to be here, and I hope that this was helpful information. Again, I am Dr. Felicia Sumner. I am your board-certified family medicine physician. I'm dedicated to empowering you to become well, and then hopefully educating your own communities to do the same. Also, news for you, I am also a telemedicine physician. Usually catering to the millennials, the busy professionals, the moms, the people who can't get out of their house right away, but anyone who would love to see me online in the state of Georgia or Pennsylvania, I'd be happy to see you. So book with me. You can see that link on my Facebook page, on my website, rodocs.com. So it was really a pleasure again talking with you guys. I hope this information was helpful, and you all have a great night. Take care.